Good health now. For a lot of people working overtime, it's hardly even overtime. It's just part of the job. But a new study is highlighting the hidden toll those extra hours can be taking on your health.
Dr. Frank McGeorge is here to explain more on this, Doc.
Well, yeah, Kim and Devin, according to a recent study, working more than 40 hours a week might put you at risk for something called masked hypertension. That's when your blood pressure is high at work or home, but not at the doctor's office, which obviously makes it harder to detect.
Does work make your blood pressure soar? Working overtime certainly might.
This study looked specifically at masked hypertension, and they found that, even if the blood pressures were normal in a relaxed environment, in a controlled environment, in the work situation, if they were working longer hours, there was a 70% higher risk for having masked hypertension.
The study looked at more than 3,000 office workers over a 5-year period. Participants wore devices to measure their blood pressure throughout the day. Researchers examined sustained hypertension, or blood pressure that's consistently high, as well as masked hypertension. They found people who worked more than 40 hours per week had an increased risk for both masked and sustained hypertension. The risk climbed even higher for people working more than 49 hours a week. It's not just a matter of added stress. Long hours at work often go hand in hand with a lot of sitting, lost sleep, and poor eating habits.
I think the most important thing is for people who work long hours to understand that they are at risk for potentially having high blood pressure. And it's important that they bring it up to their doctor so the doctors also can arrange for home blood pressure monitoring or 24-hour blood pressure monitoring.
Now, uncontrolled high blood pressure can lead to heart disease, stroke, and kidney disease, and that's why it's really important to know if you have it so you can make appropriate lifestyle changes and take medication if it's necessary. Back to you.